The Northwest has passed the 1 million mark for doses administered, but the province has some of the lowest vaccination numbers in the country. Professor Binu Luke, head of the provincial COVID-19 response team, says misinformation and the spread of falsehoods on social media are some of the reasons causing delays in getting people to vaccinate. He joins us now live to discuss this matter further. So, Professor, good afternoon. You've given a couple of reasons in terms of the vaccination numbers being low. And we saw earlier on, when the vaccination program started, there was a lot of misinformation. Some of the provinces managed to work their way past that. Why has the Northwest province not been able to do so?
So let me give you some figures in the last, so good afternoon, Tony, and thanks for the opportunity. So let me give you some figures in the last 1 week, because there seems to be a turnaround in the province in the last 1 week, because we have increased our percentage coverage from 27 to 30% in a matter of a week. And we vaccinated 50,000 new individuals. Overall, we vaccinated 80,000. That means about 30,000 are second dose vaccinations of Pfizer. We are at 1.1 million. So if you look at our daily vaccinations, we are doing between 12 to 15,000. So while some of the provinces have gone down on their numbers, we have managed to maintain the number, or in certain days increased our number. So I think with some of the mobilization campaigns that we've been doing in terms of demand creation, we are seeing some success in terms of our vaccination output. So we basically targeting different groups. We have only got about 26% of the individuals in the age group between 18 to 50 registered. That's the lowest of the groups. About 64% have registered, and about 43% have registered in the 50 to 59 group. So in the younger age group, we are focusing on the schools, especially the matriculants who are over the age of 18. We are specifically targeting them, and we are seeing successes in that group. We also targeting the religious groups and the churches. So Sunday is dedicated to vaccination in our churches, so there will be quite an impact on that particular front. We are also doing a number of outreaches, especially to our rural areas, by involving the traditional leaders to get to the plus 60 group and to the rural communities. And also we are using our health facilities to make sure that every visit and every patient is also encouraged to register and vaccinate. And obviously we are increasing the number of vaccination points. Interestingly, I was...
Sorry, Prof. I was going to just touch on that fact that the Northwest is a rural farming community, and obviously you have to bring your farmers on board. You've got to bring the farm workers on board. Are you managing to do that?
Yeah, that is one of the other areas that we are focusing on, especially in one of our sub-districts. We have got significant impact by targeting the farmers and talking to them and the farm workers, and also transporting the farm workers to vaccination sites or reaching out to them. So it is a multi-pronged strategy, but it is starting to bear fruits. In fact, in terms of coverage, we are very close to the coverage that Gauteng has achieved up to now, and we have surpassed the coverage of KwaZulu-Natal. So that we are catching up, but we are still in the bottom of the pile. We'll continue our efforts to improve our vaccination coverage.
Yeah, you are, but I know you said you picked up in the last week or so, but you are still quite a way behind the other provinces in terms of getting the vaccinations. Is there preference when it comes to some folks within the particular areas that you're dealing with? I was reading online that some of the farm workers are preferring the J&J vaccine as opposed to the Pfizer. Why would that be the case?
No, I think it's about getting done with it. So J&J is one shot, and then it's sort of defined as completed vaccination. So we do have supply of both J&J and Pfizer, even though the Pfizer vaccines are more in terms of supply. So we have prioritized J&J to the more rural areas, so that when we visit them, we can vaccinate, and then the vaccination is done with. So I think the single dose is the main motivator for preference towards J&J.
Okay, all right, Professor. Good to see that the numbers are picking up in the Northwest, and you've now vaccinated over 1 million people at this particular stage. Thank you so much there, Professor. That's Professor Binu Luke, head of the provincial COVID-19 response team in the province, the Northwest province.